my fellow MMJ caregivers when composing the amendments to the regulations and to the composition of these in the future. I beseech you to permit the retention of care given for the small gardener, for not unlike our own local vegetable farmer, we too offer a product grown with intent and purpose for our community. If you redraft our current regulations to exclude the smaller local grower, those most greatly disenfranchised will be the patients who will be unable to afford the prices the growers will inevitably demand. The cannabis of our youth, the black market marijuana, shipped in so many damp bales with devotion solely to profit, could be our reality once more if margins for such inferior cannabis are reintroduced, and it is clear they will, as such, an underlying force of small committed growers are excluded from the future of cannabis production in our state. Please consider the possibility of this outcome, the loss of monitored, individual, hands-on quality cannabis, the very same control we have strived to obtain when considering the next step for cultivation of cannabis in our state of Maine. Thank you, Jan Edwards, your Green Thumb Caregiving Services. And I decided to read this letter now because I think with the bills that are on the talking about right now affect most of these little caregivers very much. So I would have to agree with the majority of all things said by the caregivers here. We need more avenue to get rid of our products and not just one way. Thank you.
All right. Seeing no questions, thank you very much. Additional testimony in favor of at least one of these bills. Welcome.
Thank you. My name is Cindy Brown, and I'm from Starks. And I am here to testify in favor of, get these numbers all mixed up, they change every year, don't they? LD5 and LD 1258 with some reservation. I'm going to start with the LD 1258. And although she's not here, I'm very grateful for the work of Deb Sanderson in the research and understanding the base and underlying issues that we have. I think she has a very reasonable approach to medical marijuana. I feel very strongly that taxation of a medicine is wrong. And I've heard a lot of testimony about people who are, the people who are willing to pay the taxes so they have the right to grow. It seems to me that in paying for their licenses to be caregivers, that they're already giving a big chunk of upfront money to even be able to supply the medicine. And when you add on these taxes, taxes are not going to be absorbed by the business. The taxes are going to be absorbed by the patients. And to remember that none of the cost of the medicine, this is all paid out of pocket. I recently helped my brother-in-law, who just died last week of the pancreatic cancer. He received some remission relief of that for about 6 months. And it was a blessing of the 6 months. But the cost of going out and trying to find the Rick Simpson oil, the high CBD content, we spent over $2,000 trying to get this medicine for him. And it is very expensive. And to add another cost on top of that, because it's going to help some sort of bottom line with other people, that's not right. You should not allow taxation of medicine, especially when there's no reimbursement and it's all out of cost. That's another reason why LD5 is important, because it's the same issue that we had when we said you can have 3 flowering plants and 2.5 ounces of medicine. It's just not botanically correct. What do you do with that excess? And we've been struggling and struggling and struggling with this. And I think this compromise that we've come to of limiting the plants and saying whatever these plants produce can go to patients, because I do think that might possibly bring the cost down. That's my sincere hope, is that through going through this regulation, this legalization process, we are not criminals. We really aren't. But we have to bring the cost of this medicine so it is affordable for the people who need it. And that's my testimony for LD 1258 and LD 5. I believe we have to bring the cost down. Thank you.
Thank you very much. Additional testimony in favor of at least one of these bills.
My name is Peter Morris. I'm a tax accountant, and we have a couple of offices in Old Orchard Beach in Portland. The reason I'm here today is to advocate for the caregivers. Basically, what they're doing is, and my thing is going to be extremely short, but they're craving legitimacy, and they're striving for compliance. A few years ago, I had 2 maybe or 3 people that would come in to do their taxes. Didn't know what they were doing, afraid to do anything. Today, they're coming in willingly. They want to do the right thing. They want to be compliant. They want to be legitimate. Basically, this is what my philosophy is if 1258 passes, with what Ms. Sanderson was saying, is that it's going to provide more money for the coffers of the state of Maine. And in my opinion, as a business major, when I was at the University of Maine in Orono, we thought J.D. Morgan and John D. Rockefeller had the last monopolies. We thought those were wiped out by now, but I guess they're still going on in the state of Maine. Thank you very much.
Thank you. Testimony in support of at least one of these bills.
Good afternoon, Senator Brakey, Representative Kateen, and members of the committee. I'd just like to briefly speak in support of
Could you state
LD5.
your name,
My name is
please?
David Bierce. I'm a caregiver. I live in Knox.
All right.
Briefly speak in support of LD5 and LD 1258. Most of the bills that we've been talking about are, we talk about patient safety and we talk about the black market. Some people are, afraid that some of what we do may increase the black market. Well, I have a friend that's a patient who lives in Belfast. I support her very small habit out of donations because I can't afford to take on a patient at less than a quarter ounce a month. Now, living in Belfast, she would have to travel an hour in any direction to get to the dispensary. She's not going to do that. If I didn't support her, she would buy from the black market. And I'm sure there are plenty of people up north that have to travel much further that are buying from the black market as opposed to going to a dispensary because caregivers cannot support them. That's all.
Any questions? Seeing none, brevity is the soul of life. Thank you very much.
Near Belfast, they don't charge their lunch.
Additional testimony in support of at least one of these bills.
My name is Catherine Lewis. I'm a board member of MMCM, but I'm also a caregiver and a patient. And so I have both professional and personal feelings towards LD5 and LD 1258. It is not always just about excess that you need to have more patients. I think that is a theme that we've heard all day today, that we have extra marijuana and that we need to find a place to put it besides giving it away for free. That is not necessarily the case. I specialize in working with cancer patients now and making oils for them and I honestly run out and have no place to get it in between harvest or if I have a crop failure. And also, there are times when there are patients that come to you with special needs and they only use a very small amount. And whether they can afford to go to a dispensary or they choose because of fear of privacy to use a caregiver instead, it becomes a problem when they cannot be serviced because I have my 5 patient slots filled. I got a call this morning from another stage 4 cancer patient that I'm sorry I'm putting on a waiting list. There is no waiting for a stage 4 cancer patient. We need to have this limit lifted now, not later. As far as the taxation piece, it is very important that we go and look at the way that we're doing taxation. If we're going to be doing sales tax, which we already do, that we change it from the sales of a product to the service that we provide, because not everybody is selling product via a gram or an ounce. So we need to make sure that that's taken care of. I don't believe that this ever went before the taxation committee. According to one of the members of the taxation committee, it had never been there, so it had never been approved. It's not on the list. When you go to fill out the application on the state of Maine website for your sales tax number, there is no option for medical marijuana. You can either become a pharmacy, which is what they tell you to become if you call the office and ask them, or you can be a florist. Only 2 options that fit to get a sales tax ID number, but yet we're required to collect and remit sales tax on what? It's really important. It's a question that we need to ask. I know that I've heard from the Department of Health and Human Services that not enough caregivers in their estimation are paying sales tax. Well, I know for one that I am. I also own another business, Business Solutions of Maine, where I have helped hundreds of caregivers over the past 3 years establish their businesses with their federal ID numbers, their state ID numbers, their state sales tax. And every time I have to go into the online portal and check whether they're a florist or a drugstore based on their opinion. So we need to address that sooner than later as well. I appreciate the time.
All right, very much. One question, Representative Bell.
What would you like to be called? How would you like to be classified?
I'm an alternative wellness consultant. I also specialize in botanicals.
When you make your application to the state of Maine for an ID or the
A service consultant.
a service consultant, instead of caregiver, it would be service consultant.
Caregiver's okay, but it also leads to other areas where some people, I work with cancer patients, I work with very sick people. I came from a hospice background. I was a CNA and emergency room technician. So for me, being a caregiver is a true statement. But for other people, they're botanical growers. They're small farmers. They're gardeners. And so
But to look it all
it's more-
together for licensing, if I may, just,
I'm not sure we can come up with one. I am available for work
that's
sessions.
something to think about. Thank you.
See no additional questions. Thank you very much. Additional testimony in favor of at least one of these bills.
Senator Brakey, Representative Debilitating, and members of the Health and Human Services Committee, thank you very much for taking the time to consider all these proposals today. My name is Paul T. Caregiver, and I'm the president of Legalize Maine. We are supporting Maine's medical marijuana program, and we agree that it is the best medical marijuana program in the country. There's a quick reference sheet on the bills we support and not support. We support LD 5. We are opposed to LD 726, but we're open to amending the bill. We support LD 752. We support LD 766. With amendments, we support LD 1058 and 1059, and we are a strong supporter of LD 1258. One of the things I wanted to bring to your attention about when we're talking about LD 1258 is the possibility of creating a new level of caregiver. A caregiver that would be licensed for 30 flowering plants and be able to serve any amount of patients. I think it's really important from hearing everyone, the testimony before me, that we consider that this is an issue of patient choice. Patients should be able to have their provider of choice. If you get a prescription, you aren't just limited to going to Rite Aid, you aren't just limited to going to Hannaford or Walmart. You have your choice of where you can get your medication. This will also help lower the cost for patients because these caregivers who are professionals are going to be able to offer a more competitive price, and I believe that more competition in this market will be better for the patient. As we have seen over the past 4 years, the price of medical marijuana provided by caregivers has gone generally from $300 an ounce and is now anywhere down from $200 to $250 an ounce. So we have seen that the free market, whatever people's beliefs on that are, is working when it's coming down to caregivers being able to provide for patients. The other area that I think is important to consider is that these caregivers will be able to help serve underserved areas. For example, I am from Knox, and one of the previous speakers mentioned about how there was a patient in Belfast who was unable to find a provider. If we added Ed, who would be able to take them on with such low usage. If we'd be able to add this new tier of caregiver, that tier of caregiver will be able to provide for any number of patients. They would also be subject to more regulations, inspections, inventory tracking, and sales tax compliance. Even though I personally do not think that sales tax should apply to any medication, I do believe that unless it will be room for dispensaries for this tier of caregiver, it is only fair that if dispensaries have to pay a sales tax for providing for any number of patients, that if we create this new tier of caregiver, that they should also pay sales tax for any number of patients. This new level of caregiver, I think, should also be able to provide medicine to other caregivers and dispensaries. We heard from one person who unfortunately had a break-in and lost all their medication, so now the person will be relying upon donations to be able to make sure that their patients are able to be served. And that is something which I think is a continual problem, mostly when it comes down to crop failures or if you have a contamination. I've been before this committee before, in the Agricultural Committee, and 2 years ago I had an infestation of spider mites, and so I killed all my plants and had to start over again. Thankfully, I had enough excess to be able to take care of my 5 patients. But that is an important thing to consider, is that we need to be able to have this excess in case something happens, because these patients need to be able to have continual access to medical marijuana. On the last 2 pages, when it comes down to talking about how to deal with the dealings with the department, I have a outline for what a complaint investigation program could look like. I developed this last December in anticipation of the department having the report ready for the committee. This is just an outline. It's something that I think should be taken into consideration for the work session. And when we're speaking about any sort of inspections I'm going to be having to caregivers, whether we adopt a new tier of caregiver or the idea of providing inspections for caregivers who serve with 3 or more patients, I strongly believe that those rules should be major substantive, because those rules should be able to come back before this committee of jurisdiction in the legislature, because that way the most people will be able to talk to their legislature, and our people, our representatives, will be able to have control over what these important rules will look like. Something I think to consider is when you're looking at any sort of inspection regulation, you have to consider cross-contamination. You do not, if you have a clean growing space, you do not want to have someone in there who has visited any other growing space that day. Thank you very much. I'd be happy to answer any questions.
I have one quick question before you go. I'm particularly interested, and I know I've had conversations with folks about this idea of creating a second tier of caregiver. So you've got maybe this first initial tier where it is, where people are really serving a limited people in their immediate sphere. So Ken, I imagine you'll be here for the work session, and are there any other, I know I've been missing for part of the time, so I've been in other committees. I don't know if this idea has been brought up by any other folks testifying, but I would love to, at the work session, hear more from folks about this particular idea, see if it's something that the committee is amenable to, if it's something that you want to pursue.
Thank you. And the reason that we developed that idea is because we don't want to have any sort of interference for the person who I'm going to call the traditional caregiver, the caregiver who's providing for a limited number of people. Because if I become ill and I think that you're a great gardener, I should be able to come to you with the least amount of bureaucratic interference for you to be able to provide medicine for me. Now, if I want to start a business, that's a whole other animal. If I decide to want to start a business with this, I believe there are additional regulations and protocols that are appropriate, that when it comes down to serving more than 5 patients. And I'll be happy to be at the work session and answer any questions there, or you can see me in the halls.
All right, thank you.
Thank you very much.
Oh, there's additional questions. Representative Burstein.
Thank you, Mr. Chair. Mr. Courier, just a real quick question. Is there a shelf life to, like you were saying, that holding some marijuana in case somebody else didn't have some? Is there a shelf life to
A lot of it depends on the conditions on which it's kept. If you keep the humidity proper, there's these great things called beta packs. You can keep the proper humidity and you keep it in a cool, dark spot. It can maintain its potencies I've seen for upwards of over a year. I remember back in the day, some old hippies telling me how they used to freeze it, or they put it into mason jars and seal it and then bury it, and then be able to dig it up in the springtime and still be as good. So I think the shelf life will vary, but a lot of it depends on the conditions in which you keep it. Thank you.
All right, seeing no additional questions, thank you very much. Additional testimony in support of any of these bills, these 5 bills before us right now. All right.
Hello, Senator Brakey. Hello, Representative Beteam. My name is Don Benson. I'm from Hartland. I'm a patient and a caregiver, and I apologize because I didn't bring any written information because I didn't plan to talk. I have difficulty speaking in public. I support LD5. I support most of the LD 1258 except for the unannounced warrantless searches. Last year, the MMP program tried to introduce new laws. They were terrible. They were warrantless searches. They were based upon complaints, anonymous complaints, that the department would decide if it warranted a search. You guys laughed them out. If they talked to you, they down-talked to you guys. You guys said, get out of here. No, we're not going to pass any of what you want. Come back with some criteria for inspections. This year, the department decided to implement some of last year's knocked-out rules without permission. They changed the registration with the doctors without permission. They started the warrantless searches. They don't have the money to respond to law enforcement if someone's a caregiver, but they have the money to hire the sheriff's department for close to $200,000. They also want permission in the future to make any rule changes they want without the legislature approving it. That's terrible, in my opinion. I oppose 726, and I think the discussion on 726 from the dispensary owners and from the attorneys for dispensary owners is the most self-serving discussion I have ever heard in my life. I'm finished.
All right. Thank you for your testimony. Additional testimony in support of any of these 5 bills?
Okay, well, good afternoon, Senator Brakey, Representative Team, and members of the committee. My name is Faith Benedetti. I am a patient, a caregiver from Winthrop. I've stood before this committee for the past 4 or 5 years. I'm one of the initiators of our 2009 medical marijuana law, so it's fair to say that I'm one of the mothers of what's happening here. There are many who've come before me, many more who've grown this plant and done this work before me. But this incarnation I'm pretty proud of. I was on the 2010 Governor's Task Force on Implementing Law, and I've seen many changes. Every time I've been here before the committee, I've been here on behalf of patients. I'm not a person who tends to get personal about my own life, but I am here on a personal mission today, and I'm going to tell you a little bit about my work as a caregiver. So I'm in favor of LD5. I would like to see more patients. I've been given a very special gift in this life, and that is that I'm a healer. I'm a medical intuitive. Sometimes people feel better when they're with me for no reason that they can understand, or I can either. You and I can have a conversation, and somewhere along there, I could say, you know, what's wrong with your liver? Something wrong with your pancreas? What happened to your shoulder? Many of the patients that I work with, cannabis would be a treatment for them. I can only have 5 patients. I'm a woman in transition, and I've had 2 very difficult encounters this year in my work that have made me question whether I can continue to do this work. One, I was looking for financing to increase my business. I was told by my bank that I had to shut my account because they couldn't do business with anyone. As a federal lending institution who is knowingly in violation of federal law. The second difficult conversation I've had was just last month with my accountant, who looked at the amount of money that I was making doing this and said, with this look that you don't want to get from your accountant, that said, I think you're really a failure at this field. You aren't making any money. You're not hardly surviving at this. Don't you think you should get a W-2 job? I'm telling you that I am doing my work in the universe. I am trying to do my work in the universe. I receive phone calls every day that I have to pass off to other caregivers in this room. They can't see other patients either. I am a medicine woman. I want to be able to pay my bills. I deserve to be able to pay my bills. I've been helping people with this medicine for 40 years, countless patients. Allow me to serve as many patients as I can with a number of plans, capped at 30, 36 in my case because I'm a patient also, and I need to rely on a steady supply of my own medicine. Thank you so much for hearing everybody today in impassioned testimony. And thank you for the work, especially as Representative Sanderson and Senator Haskell, for continuing to carry the torch for marijuana in this Maine legislature. I'll take any questions, but thank you.
Questions from the committee? Seeing no questions, thank you very much for your testimony.
Thank you.
Additional testimony in support of any of these bills?
Good afternoon. Senator Brakey, Representative Debilitating, and members of the Health and Human Service Committee. My name is Leo Trudell. I hold a PhD in finance. My dissertation is specific to assisting farmers in Maine. I'm an executive director of Safe Alternatives, a registered Maine medical marijuana dispensary, as well as a finance professor who specializes in business development at the University of Maine at Fort Kent. My purpose for speaking to you today is to address the following issues. The inconsistency in product that patients are receiving from Maine caregivers, the amount of excess marijuana that is being diverted into the black market in Maine, the loss of tax revenue that is not being collected from caregiver sales. These problems resulted because caregivers are not being regulated by the state of Maine with the same standards that dispensaries are. Each year, dispensaries are required to pass a rigid certification process. This process audits each dispensary on strict criteria, assessing both financial and performance standards. Below is a brief summary, for comparative purposes, of some but not all of the standards, which include the practices and their outcomes. Objective discussions on basic financial statements and comparing current and prior years to determine if money laundering is taking place. An analysis of overall financial positions and results of operations to determine where financing is originated. An analysis of balances and transactions of individual funds and patients' accounts to assess that patients are truly being served. An analysis of operational procedures with assessments of best management practices to determine that a quality standard is met. An analysis of procedures which assess the chain of command to determine if any diversion of product is taking place. An audit of sales to patients to determine that sales taxes are being paid in full. And a random physical inspection at any time to ensure operations meet specific codes. Caregivers, on the other hand, are licensed to grow without any oversight, audit, or inspection. There are between 1,700 and 1,800 caregivers in the state of Maine. A startup caregiver is required to apply to HHS, consent to a background check, and pay a maximum startup fee of $1,331. There are no additional requirements, yet the state of Maine may generate as much as $2.4 million from the revenue source. There is no reliable source verifying the revenue from caregivers. The growth of caregivers over the past 5 years has been exponential. Based upon a conservative model, a caregiver can yield 576 ounces of prepared marijuana per year, grossing in the vicinity of $144,000. Today, we heard as much as 3 pounds. And with multiple cycles, that could be $500,000 to $1 million a year.
Yeah, I wish I got that.
Hey, sorry, just want to pull for a second. I know it's been stated multiple times as we've been through this. I don't know if people have been here for it, but we need to refrain from outbursts during, whether it's for or against whoever's testifying. Everyone has an opportunity to share their thoughts and to say what they'd like to share, but we really can't have outbursts from the audience. This is to be a place of respect for everyone's point of view. That's why people are here today. So, sorry for interrupting. Please continue.
Thank you. This is a cash business with no oversight, providing little and no incentive to pay Maine sales taxes or Maine income taxes. This double standard between dispensaries and caregivers must be rectified. Furthermore, according to the state of Maine, the maximum amount that a patient can buy and what a caregiver can produce is considerably different. Using a conservative estimate, caregivers are producing 60% more than what the legal patient market is demanding. In aggregate, there could be in the vicinity of 24,300 pounds of excess marijuana being diverted onto the black market in Maine by caregivers without audit, control, or oversight. This begs the following questions. What type of quality control is being implemented onto caregivers to assure that the same standard as dispensaries are in place? What is happening to the excess production and who is receiving it? Why aren't caregivers held to a strict standard for payment of sales taxes and income taxes? And should the HHS be regulating the production of caregivers, or should law enforcement officials? And most important, does Maine want to be labeled the easiest place to grow marijuana outside caregivers? In conclusion, I feel the additional regulation proposed by LD 726 will provide necessary tools for both Legislature and DHS to better regulate the caregiver market. Furthermore, it will provide additional revenue in the form of sales taxes and personal income taxes to the state to provide for a more appropriate level of monitoring, oversight, and enforcement. Thank you for your time today, and I'm happy to answer any questions at this time.
All right. Thank you very much. Seeing no questions from the committee, thank you for your testimony.
Thank you.
Oh, is there a, I'm sorry, there's one question. Representative Hammond.
I apologize, I had to find the bill.
Yes, sir.
It sounds like you're very well versed in the financial aspects of this. With regards to the inspection aspect, you said this was your dissertation?
My dissertation is specific to farming in Maine as it pertains to business planning and success of farming.
Oh, okay, that was specific to marijuana.
However, what I would say is that if we're taking a look at it, it seems like the shift is, or a great deal of the shift that has taken place here is from policy and security. And when we're talking about security, we're talking about diversion, especially as it pertains to youth. And this bill is not about economic development. These discussions here are not about economic development. They should be about good policy.
Sure, and I guess my question was specific to the inspection aspect.
Yes, sir.
And the department being able to enter the cultivation facility at any time without notice.
Correct.
From an agricultural standpoint, do you think that's a wise thing for the department to do?
Why not? They're doing, I mean, you're developing a double standard. Hey,
Can they do that?
Would you call up a crook and 24 hours before you're gonna go visit them? And by no means am I calling, there's very good caregivers out there, and they're very compassionate, and they do a good job. That probably didn't come out as well as it should have. However, what I will say is, if you have more than 36 plants and you call somebody up 24 hours beforehand, what would stop them from moving them?
Okay, and I think my question was, I guess, agricultural and in terms of, this is an area of expertise.
It is, actually.
Okay, so would it harm a plant to expose it to light at a time when it should be? Because we did that earlier, and I guess that, for me, that's what this, whether I'm going to vote for or against this.
That's a very good question. Now, when individuals are talking about turning on lights, they're talking about turning on 1,000-watt lights. And yes, that will harm a plant, and that will potentially make it hermaphroditic. However, at the same time, there's lights, a small light bulb could be turned on in order to walk in and count the number of plants. And that's not going to hurt it. It doesn't mean that you have to stay in the room. There could be some common courtesies that are taking place in order to regulate properly and meet in the middle.
Any additional questions? Seeing no additional questions, thank you for giving your testimony before the committee today. Is there any testimony in support of any of the 5 bills before us? Welcome.
Good afternoon, Senator Brakey, Representative, I guess Representative Hammond, and members of the committee. My name is Hillary Lister. I live in Athens, Maine, and I'm here to speak in support of LD 1258, an act to amend the Maine Medical Use of Marijuana Act with regard to good business practices, and also address how a lot of what is being asked for in LD 726 could be more appropriately addressed through LD 1258. What I've passed out is a timeline of how Maine's medical marijuana has developed and changed over the years. Originally a caregiver